Hi, Dr. Zinkevich. How are you doing today?
I'm okay. I'm here because I recently broke my ankle and I was a little concerned because I've broken 11 bones before and they're all caused from minimal trauma, so I was a little worried about it.
Okay. So, anything else? Any other symptoms? Dizziness, fatigue?
No.
Okay. So, why don't we talk about the history of your breaks? When was your first break?
When I was 2 years old, I was climbing on the recliner in our living room and I fell off and broke my heel.
So it says here that you had a closed, incomplete stress fracture on your right calcaneus. Is that correct?
I was 2, so yes.
Okay. Have you had any tests done recently?
No, I only go to the doctor when I break another bone, so.
Okay. How have your breaks been taken care of in the past?
They put me in a cast to immobilize the bone.
Okay. What's your normal exercise routine?
Well, I'm a cheerleader, so exercise is huge, and I have to exercise on a daily basis.
Okay. What would you say your eating habits are?
I would say they're pretty healthy. I mean, they're not salads every night, but it's not McDonald's either, so.
Mm-hmm. Okay. Do you have any smoking or drinking habits? Is there any chance you could be pregnant?
No, I don't smoke or drink, and I'm not sexually active.
Okay. On to your family history. Has anyone in your family experienced a genetic disease?
My mom's great-grandfather had type 1 Osteogenesis imperfecta.
What were his symptoms?
He had a triangular shaped face, and he had a blue hint to the white of his eyes, and he had brittle teeth, and he dislocated his joints a lot.
Okay. And how did he die?
He had a massive heart attack.
Okay. Well, I'm gonna order you some tests, including a urine analysis, to collect a blood sample, and to do some X-rays and do a bone density scan. I'm also gonna go get the supplies, and I'll be back shortly.
Okay.
Okay. I'm going to need you to pee in this cup and go into the bathroom over there, and you can do that. And when you're finished, can you bring me a sample?
Okay.
Thank you. Okay. Now I'm going to be taking some blood. So, just relax in your left arm. Okay, ready? And we're good. Okay. We're gonna go get some X-rays, and we'll be back as soon as I take off your arm. Okay, let's go.
Hi.
Hi, nice to see you again. Your test results have come in. Your urine analysis is unremarkable. The blood that we took, we did a genetic test on it, and we found that your COL1A1 and COL1A2 genes have specific markers in them that carry osteogenesis imperfecta. The x-rays that we did a DEXA, which shows the bone density scan and showed severely diminished bone density. You see here how there's the bowing in the arms of your x-ray. This is an x-ray of an example of a healthy bone, and it's just straight, how it's supposed to be. So, that's another sign of osteogenesis imperfecta. All of these tests indicate and confirm that you have type 1 osteogenesis imperfecta.
Why did this happen to me?
There's no particular reason. It's caused by a defect in the genes of the bone. It affects about 85% of the connective tissue that holds the bone together. It also affects the bone quality and mass. It happens to about 1 out of 12,000 to 15,000 children a year. It can happen to anyone with this gene. There's no one in particular that's targeted.
Well, what am I supposed to do?
I have a pamphlet here. I'm going to explain to you. There are some treatment that we can do. There's no known cure, but there are many things we can do to decrease the likelihood of you having more fractures. First, we can reinforce your bones using telescopic Fraser-Duval rods. They're metal rods that it's an invasive surgery. It just reinforces the bone, so the bone doesn't have to bear as much weight. There's also the risk of having osteoporosis, which is where the bone destruction is faster than bone remodeling. So it causes low bone density, which makes it easier for the bone to break. To try and avoid this, you have to continue to do a healthy diet, low impact exercise, weight bearing, on a daily basis. We can establish a bone density, so as we observe you throughout life, we can see how much bone you're losing and try and do some more things to make it stop or slow it down. There's some medications we can prescribe that is known to help decrease bone loss and help with the pain. One example is bisphosphonates, which like I said, it greatly reduces bone pain and fracture rate, and it helps slow down the destruction rate of the bone. When breakage does occur, we'll limit your time in a cast to avoid as much bone loss as possible. And so just try not to break things. Avoid smoking and excessive alcohol, because it'll make the bone loss go faster. You're also at a higher risk for scoliosis, diabetes, heart disease, cancer, and a barrel-shaped chest. So we'll keep an eye on your respiratory health, and we'll do a pulmonary test 2 to 3 years. Make sure you get your flu shot and pneumonia vaccines when you need it. I know this isn't going to be easy, and it's a very long road ahead, but now that we know what you have, we can help you make and live an easy and as normal life as possible.
Well, thank you for everything. I'll do everything you said.
I'll schedule you for your needed tests, and we'll go from there. Awesome.
Thank you.